She was the nurse nobody looked at twice. Quiet, slow, forgettable. They called her dead weight. They rolled their eyes when she walked into a room. The senior doctor told her, to her face, that she didn't belong in an emergency ward. Then the factory blew. 32 casualties. Screaming. Blood on every surface. Doctors freezing mid-sentence because the damage was too catastrophic, too fast, too much. And the woman everyone had written off? She was already moving, hands steady, eyes locked, voice calm in a way that didn't belong in any hospital, because it had been trained somewhere else entirely. If this story already has you holding your breath, follow along to the very end. Like this video and drop a comment telling me what city you're watching from. I want to see exactly how far this story has traveled. The overnight shift at Riverside Valley Medical Center started the way most shifts did in a mid-sized ER, with fluorescent lights that buzzed just slightly off-pitch, a waiting room that smelled like disinfectant and old coffee, and a charge nurse who made it her personal mission to remind everyone exactly where they stood in the hierarchy. Linda Mercer had been at Riverside Valley for 14 years. She walked the ER floor like a woman who owned it, clipboard pressed against her chest, reading glasses perched at the end of her nose, and a talent for delivering criticism that sounded almost like concern. Almost. Megan Calloway had been at Riverside Valley for 11 weeks. She clocked in at 6:47 that Tuesday morning, 13 minutes before her shift officially started, hung her coat in the staff locker room, and spent 3 of those extra minutes in the break room making sure the crash cart for Bay 4 had been properly restocked after the previous night's code. It hadn't. She restocked it herself quietly, without mentioning it to anyone. That was Megan's way. She was 34, medium height, with a face that people tended to forget the moment she left a room. Brown hair pulled back in a functional braid. No jewelry except a small, worn watch on her left wrist, analog, with a scratched face and a military-issue band that had seen better decades. She moved through the floor without urgency, which some people misread as sluggishness. She spoke in measured sentences, which some people misread as uncertainty. Linda Mercer had decided somewhere around week 3 that Megan Calloway was a problem. "She's too slow," Linda had told Dr. Ethan Ward in the hallway outside the physician's lounge, not particularly quietly. "She double-checks everything, asks too many clarifying questions. The other nurses are starting to notice." Ethan Ward was the kind of doctor who had been told he was exceptional for so long that he had stopped questioning whether it was true. He was 41, kept his white coat pressed, and had a habit of addressing nurses by their last names when he was being condescending and by their first names when he wanted something. He'd reviewed Megan's intake paperwork when HR flagged her unusual employment gap, 7 years between her last listed job and her application to Riverside Valley. Her references had checked out, but nobody from the hospital had dug deeper than that. There hadn't seemed to be any reason to. "She'll either figure it out or she won't," Ethan had said that day in the hallway, glancing at his phone. "Give her another few weeks." That conversation had taken place 4 weeks ago. Now it was Tuesday morning, and Megan was doing her rounds in the ER, checking on a 60-year-old man named Gerald, who'd come in overnight with chest pain that turned out to be acid reflux and a talent for catastrophizing when Linda materialized at her shoulder. "Calloway, Mrs. Doran in Bay 7 needs her IV adjusted." "I checked on her 20 minutes ago," Megan said, not looking up from Gerald's chart. "Drip rate's correct per the order. She's been pulling at the line because she's uncomfortable. I was going to ask Dr. Paulson if we could—" "I didn't ask for your analysis," Linda said. "I said, adjust the IV." Megan closed the chart. She looked at Linda directly, which Linda always seemed faintly surprised by. "If I adjust the rate without a new order, I'm outside protocol. I'm authorizing it." "You're not a physician." The pause that followed was the kind that had temperature to it. "Do you have any idea," Linda said, her voice dropping to something that was carefully controlled, "how close you are to a performance review?" Megan held her gaze for a moment, then nodded once. "I'll go check on Mrs. Doran." She walked to Bay 7. She sat with Mrs. Doran for 6 minutes, repositioned her arm so the line wasn't pulling, asked about her discomfort, and found out the real issue was that the woman was terrified and had no one in the waiting room. Megan stayed an extra 3 minutes just talking. She did not adjust the drip rate. By 9 a.m., the waiting room had filled up in that particular Tuesday morning way. A construction worker with a hand injury, 2 kids with fevers, a woman in her 70s who'd slipped on her porch steps. Ordinary. Manageable. The kind of shift that didn't ask anything extraordinary of anybody. Ethan Ward came on at 9, did a brisk lap of the floor, and stopped at the nursing station where Megan was updating charts. Calloway. He set a patient folder on the desk without looking at her. Michael's in Bay 2. His wife says he's been in pain for 6 hours. I looked at the chart. Previous nurse noted the pain level at a 4. Seems low. Go reassess. Megan picked up the folder. Read it. The previous note is from 4 hours ago. If he's been symptomatic for 6... That's why I'm asking you to reassess, Ethan said, with the particular patience of someone explaining something to a person they believe is slow. She didn't respond to the tone. She went to Bay 2, spent 8 minutes with Mr. Michaels, came back, and told Ethan directly that the pain was presenting atypically for the recorded diagnosis, and that she thought they should consider an abdominal CT. Ethan looked at her. Based on what? His guarding reflex is wrong for the documented complaint. He's protecting his right side, not his left, and the pain shifts when he changes position. Could be appendiceal. There was a beat. Ethan picked up the folder, looked at the notes, looked back at her. I'll order the imaging, he said finally, as if the decision had originated entirely with him. The CT came back an hour later. Early stage appendicitis. Ethan told the nurses' station about it in a tone that implied he'd caught it himself. Nobody said otherwise. Megan updated the chart and moved on. That was also Megan's way. At 11:14 a.m., the call came in. It didn't come through the normal dispatch frequency. It came in 2 ways simultaneously, the hospital's emergency line and a county EMS alert, which was the first sign that what was happening was not ordinary. The charge desk coordinator, a young man named Tyler, who'd been at the hospital 3 months longer than Megan, picked up the emergency line and went very still in a way that made Megan look up from across the floor. How many? Tyler said. Megan was already closing her chart. Confirmed how many? Tyler's voice had gone careful and high. Copy. Yeah. Okay. We'll be ready. He set down the phone and turned to the room with the expression of someone who had just received information that their nervous system hadn't fully processed yet. Calloway Westfield Fabrication Plant, he said. Out on Route 9. There was an explosion. It's a major incident. Multiple casualties inbound. EMS is estimating. He checked the notepad where he'd been writing. 32 victims initially confirmed. More possible. They're diverting to us, Mercy General, and St. Augustine's. The ER floor went quiet for exactly 2 seconds. Then Linda Mercer's voice cut through. All available staff to the trauma bays, now. I want every bay cleared and prepped. Tyler, get me the MCI protocol binder. Somebody activate the trauma team pager. The room erupted. Nurses moved in 3 directions. Someone knocked over a chair. A supply cart got pulled too fast and clipped the door frame of Bay 3. Megan walked to the supply cabinet on the east wall, opened it, and began pulling what she needed in a sequence that was not random. Trauma shears, tourniquet, chest seal kit. She moved with an economy of motion that had nothing to do with casualness. It was the specific efficiency of someone who had done this when the stakes were not hypothetical. When the ground under her feet was not linoleum but packed dirt or a ship's deck or something worse. And when the wrong supply choice could mean someone didn't come home. She was at Bay 6 setting up when Linda appeared beside her. Calloway, I need you on triage out front. Megan looked up. Triage needs 2 people minimum and someone who can make fast disposition decisions. I should be in here. I didn't ask for your input on staffing. You've got 3 bays that aren't prepped for penetrating trauma. If these are blast injuries, front, now. Megan stopped, set down what she was holding. Okay, she said, and went. The first ambulance arrived 8 minutes later. They came fast after that, not in a steady stream but in a compressed wave, 3 rigs pulling into the bay within 90 seconds of each other, and the scene outside the ER entrance became exactly what anyone with any mass casualty experience would have predicted and prepared for. Controlled chaos trying to become actual chaos. The first victim Megan saw was a man in his 50s, construction clothes shredded, right arm wrapped in a field dressing that was already soaked through. The paramedic rolling his stretcher was a woman named Santos, who Megan had worked with before. Efficient, direct, no drama. Blast injury, right forearm, Santos said, already moving. Possible radial artery involvement, blood pressure dropped in transit, pulse ox 89. BP? 94/60 when we loaded him. We lost a number on the way in. Megan walked alongside the stretcher, peeled back the edge of the dressing, assessed without slowing down. "What's your name?" she asked the man. His eyes were glassy but tracking. "Davy," he said. "Davy Kowalczyk." "Davy, I've got you. You're at Riverside Valley. We're going to take care of your arm." She kept her hand on his wrist, fingers over the pulse. It was thready but present. "Can you feel your fingers?" Yeah. His voice was shaking. "Good. That's good." She got him into Bay 2, which had been vacated and prepped. She called across the floor for a type and cross-match, pushed a pressure dressing, elevated the arm, and was starting to establish a second IV line when Ethan appeared in the bay doorway with two other nurses trailing behind him. "What do we have?" he said, looking at Davy, then at the monitor, then, with an expression that suggested something hadn't been set up the way he expected, at Megan. "Blast injury, right forearm, possible radial artery damage, pulse ox climbing since we got him in, 93 now. I've got one line starting a second. He'll need imaging and vascular surgery consult." "Good. Nurse?" He gestured at one of the nurses behind him. "Take over here. Calloway, you're relieved." Megan looked at him. "I'm midline. You're on triage assignment. There's no one outside right now. The assignment stands." His voice had that particular flatness that wasn't quite a shout but carried the same force. "Step back." The other nurse moved in. Megan stepped back. She looked at Davy Kowalczyk once more. His vitals were stabilizing, the monitor showed 95 and climbing, and left the bay. For the next 40 minutes, the ER ran at a level that exposed exactly which people had been trained for crisis, and which had been trained for the memory of crisis. Linda was on the floor and moving, but her directions were reactive rather than anticipatory. She was managing what was in front of her rather than what was coming. Ethan was in Bay 1 with the most critical patient, a young man with a head wound who needed a surgical team that wasn't on site yet, and the effort of that case was consuming him entirely. There were 6 bays running simultaneously. There were 2 that were understaffed. There was a patient in the hallway on a stretcher who had been triaged as a lower priority, but whose color Megan didn't like. She stopped at his stretcher. He was young, early 20s, maybe, and he'd been tagged with a yellow triage band, meaning delayed treatment. He had burns across his left shoulder and neck, and a leg wound that had been field dressed but not properly assessed. He was conscious and answering questions when she stopped, but his breathing was wrong. She put a hand on his sternum, felt the quality of it. "What's your name?" she said. "Marcus." His voice was thin. "Marcus Delvey." "Marcus, how long has it been hard to breathe?" It wasn't at first, but now." He tried to take a deep breath and something in his expression fractured. "It hurts." "Right here." He pressed his hand to his right chest. Megan unclipped the stethoscope from her neck. She listened. Right side, then left. The difference between them was significant enough that it made something in her chest go still and deliberate. She stood up. Looked down the floor for Ethan, who was behind a closed curtain in Bay 1. Looked for the attending on call, Dr. Reyes, who was supposed to be in the building but whose location she didn't know. "Marcus," she said, "I need you to stay calm. Your breathing is going to get a little easier in a moment, okay?" "Okay," he said. He was trying to believe her. She went to the supply cabinet at the end of the hall, pulled what she needed, came back. A nurse she didn't know well, Priya, second year, working fast and clearly stressed, appeared beside her. "What are you doing?" Priya said. "Tension pneumothorax," Megan said. "His right lung is compressed. I need to decompress it." Priya stared at her. "That's a physician procedure." "I know, Megan was already gloved. "Get me Dr. Ward or Dr. Reyes right now. Run." Priya ran. Megan watched Marcus Delvy's breathing deteriorate over the next 90 seconds in a way that made the timeline very clear to her. His lips had gone a shade of gray-blue that she had seen before, in places far from here, on people who were running out of time in measurable increments. She looked down the corridor. No physician. She looked at Marcus. She made the decision the way she had been trained to make decisions when the hierarchy wasn't available and the clock was the only authority left. She marked the site. She inserted the needle. The sound was small and specific, a soft rush of air that meant pressure equalizing. Marcus's breathing changed within seconds. The blue tinge at his lips began to fade. His oxygen saturation, which had been trending toward the low 80s on the monitor, started climbing. She was securing the procedure when Ethan Ward came out of Bay 1. He stopped, looked at Marcus, looked at the needle, looked at Megan. "What did you do?" he said. His voice was very quiet, which was somehow worse than if he'd raised it. "Needle thoracostomy." He was in tension. His sat was dropping and there was no physician available. Ethan walked to the stretcher, checked Marcus himself. Vitals, position, the site of the procedure. His jaw was tight. "You performed a physician scope procedure without authorization," he said. His lips were cyanotic. He had maybe 90 seconds. "That is not your call to make, Calloway. It was either my call or no one's." Ethan's eyes were flat and cold. "You will not touch another patient until we have discussed this with administration. Do you understand me?" Megan looked at Marcus Delvey, who was breathing, actually breathing, chest rising and falling with something approaching normal rhythm, color coming back into his face, eyes tracking. "Understood," she said. She stepped back. She kept her hands very still at her sides. Down the corridor, the doors burst open again. Another stretcher, another paramedic calling out numbers. The ER kept moving around her, frantic and human and imperfect, and Megan stood in the middle of it with the stillness of someone who had learned a long time ago that stillness was not the same as surrender. She waited. The noise of the ER floor, monitors alarming, voices overlapping, someone calling for a blood type from across the room, washed over her and through her without touching anything essential. She had been in worse. She had stood in worse with less to work with and more to lose. Linda Mercer found her at 1:08 p.m. "Director Hale wants to see you," Linda said. Her expression was not unkind exactly, but it was satisfied in a way that she wasn't quite managing to conceal. "Now," Megan nodded. She took one last look at the ER floor, at Marcus Delvey, stable now, his color fully returned, at the managed chaos that had not quite become catastrophe, at the other nurses still moving through it, and she walked toward the administrative corridor. She didn't say anything. She didn't need to. In the hallway outside the director's office, she sat in one of the plastic chairs that lined the wall and folded her hands in her lap and waited with the patience of someone who had learned that particular skill in places where impatience cost something real. Director Hale came out 20 minutes later, looked at her with an expression that mixed genuine discomfort with institutional necessity, and said, "Ms. Calloway, pending a formal review of today's events, I'm placing you on suspension until further notice, with pay." "But—" "Understood," Megan said. She stood. She collected her things from the locker room. She walked out through the side entrance because the main entrance was still running ambulances and she didn't want to be in the way. She was in the parking lot, key in her hand, when she heard it. It was distant at first, a sound that the ordinary ear might have registered as traffic or construction. But Megan Calloway's ear was not an ordinary ear. It had been calibrated in environments where that particular frequency meant something specific and immediate. She turned and looked at the sky. The helicopter was coming in low and fast from the northwest, and it was not a news helicopter, and it was not a civilian medical transport. She could tell by the sound before she could see it clearly, the distinctive double-blade rhythm, the pitch of the rotors, the specific urgency in the approach pattern. Military. She stood in the parking lot with her key in her hand and watched it come down. The helicopter didn't land in the designated rooftop pad. It came down in the ambulance bay. That alone told her something. The rooftop pad was the correct approach for a medical transport. The ambulance bay was what you chose when you needed immediate ground-level access, and you didn't care about procedure because someone in that aircraft was out of time. Megan stood at the edge of the parking lot and watched the rotors slow. The side door opened before the skids had fully settled, and two men in tactical gear jumped out and began pulling a stretcher from the interior with the focused, economical movement of people who had done this under worse conditions than a Tuesday afternoon in Havenport, Ohio. She could see the casualty from 40 feet away. Male, large frame, upper body wrapped in compression dressings that were dark through in two places. His head was moving. That was something. But his movement had the quality of someone fighting against a body that was losing the argument. 3 more men climbed out, tactical gear, all of them. No unit insignia visible, which itself was information. One of them was on a phone. Another was scanning the area with the particular alert posture of someone whose threat assessment never fully switched off. The third was walking ahead toward the ER entrance with the air of a man who intended to walk through the door, whether it opened for him or not. Megan's feet made the decision before she'd consciously authorized it. She was moving. She cut across the lot at an angle that brought her to the ambulance bay as the stretcher hit the ground, and the man leading the group, mid-40s, jaw like a cinder block, a cut above his left eyebrow that someone had butterfly taped in the field, turned and looked at her with the immediate assessment of someone who categorized people fast. "Ma'am, you need to step back." "What's his status?" she said. He blinked. The question had come out in a register that didn't belong to a bystander. "Who are you?" "I'm a nurse. What's his status?" The man on the phone lowered it slightly and looked at her. Something shifted in his expression that she didn't have time to read. The man with the taped eyebrow looked at the casualty, then back at her. "Penetrating trauma, upper right chest and left shoulder. We packed the shoulder in the field, chest seals holding, but his breath sounds are degrading. He's been in and out." "How long since injury?" 41 minutes. She was already at the stretcher, hands on the frame, and the 2 men who'd been controlling it had separated slightly to accommodate her without deciding to. Instinct overriding protocol, because she was moving like someone who knew what she was doing, and right now that was what mattered. "Get him inside," she said. They moved. The ER entrance slid open, and the noise of the floor hit them immediately. Still elevated from the factory casualties, monitors alarming, voices crossing over each other, the specific controlled chaos energy of a department that had been running at surge capacity for 2 hours and was starting to feel the weight of it. Tyler at the charge desk looked up, saw the tactical gear, saw the stretcher, and reached for the phone without being told. Linda Mercer appeared from the corridor that led to the trauma bays and stopped when she saw the group. Her eyes went to Megan at the front of the stretcher. A visible tension ran through her expression. "Calloway, you're on suspension. He needs Bay 1, Megan said. "It's the largest trauma space, and the crash cart's fully stocked. I restocked it this morning." "You don't have authority to—" "Linda." The man with the taped eyebrow said it quietly. He wasn't raising his voice. He looked at Linda with an expression that was not aggressive and was somehow worse than aggression. "Where is Bay 1? Linda pointed. They went. The casualty's name, she would learn in the next 3 minutes, was Commander Darius Volk. 47 years old. He had been a Navy SEAL for 22 years and had the body of someone who had spent those years doing things that bodies were not designed to sustain indefinitely. He was currently unconscious, which was new. The man with the taped eyebrow, who identified himself only as Garrett, said he'd been responsive in the helicopter and had gone under in the last 4 minutes. Ethan Ward came into Bay 190 seconds after they arrived. He took one look at the patient, one look at the tactical gear on the men arranged around the bay, and straightened in a way that suggested he was recalibrating something. "What do we have?" he said, and his voice had that attending physician authority that worked well in most circumstances. Garrett started talking. Ethan listened, pulled on gloves, moved to the stretcher. Megan was already there. She had cut away the dressing over the chest wound and was assessing what was underneath with her hands and eyes and the focused attention of someone building a picture fast. "Calloway." Ethan's voice had an edge. "You're on suspension. Step back from the patient." She didn't look up. His trachea's deviated, slightly, but it's there. The chest seal may be occluding on one side and creating a buildup. I see that. Do you want me to be... Step back. He said it with a quiet finality that was meant to be the end of the sentence. She stepped back. She stood at the edge of the bay with her arms at her sides and watched Ethan assess the wound. Watched him reach the same conclusion she had reached 30 seconds earlier. Watched him begin the intervention with the slightly too deliberate movements of a physician who was competent but not comfortable with this specific presentation. Garrett was watching too. He stood near the bay entrance, arms crossed, and his eyes moved between Ethan and Megan with an expression that was calculating something. "Can someone tell me," Garrett said to the room in general, "why the nurse who walked that stretcher in here is standing in the corner?" "She's on administrative suspension," Linda said from the doorway. "She violated protocol today during the mass casualty event." Garrett looked at Linda. "What protocol?" "She performed a needle thoracostomy on a tension pneumothorax patient when no physician was reachable," Megan said flatly from the corner. "The patient survived. His SAT was at 81 when I started and 94 when Dr. Ward arrived." The bay was briefly quiet except for the monitors. Garrett uncrossed his arms. He looked at Megan with a new quality of attention. "How long have you been a nurse?" he said. 11 weeks at this hospital." "And before?" She met his eyes. She held the look for exactly 1 beat. "That's not relevant right now." Garrett didn't push it, but he also didn't stop looking at her. At the stretcher, Ethan had finished the chest intervention and Volk's vitals were responding. Slightly, incrementally, the monitor trending in the right direction rather than the wrong one. But something wasn't right, and Megan could see it in Ethan's posture before she could see it in the numbers. He was slowing down. The specific slowing of a physician who has gotten to the edge of their confident knowledge and is now working from memory of a textbook rather than practical experience. "His pressure's not coming back the way it should," Ethan said, half to himself, half to the room, even with the decompression. "Check the left shoulder wound," Megan said. Ethan looked at her. "The field dressing," she said. "Garrett said they packed it. If the packing's shifted in transport, Callaway. If the packing's shifted and there's active arterial bleeding underneath it, his pressure won't recover regardless of what you do with the chest." She kept her voice even, not aggressive, just clear. "It takes 30 seconds to check." Ethan held her gaze for a moment. Then he looked at the shoulder. He peeled back the field dressing, and the reason for the pressure numbers became immediately visible. "Get me a vascular kit," he said. His voice had changed, the authority still there, but the defensiveness gone. He was a physician who had just been shown something he'd missed, and to his credit, he moved. Megan stayed in the corner. Priya appeared beside her, the young nurse from earlier, the one who had gone to find a physician when Marcus Delvey was struggling to breathe. She leaned close and said quietly, "Dr. Reyes just came in. He's asking why you're not at the patient." "Because I've been suspended," Megan said. "But you—" Priya stopped. Looked at Volk on the stretcher, looked at the controlled effort Ethan was making, looked at Megan. "This is stupid," she said. It came out more forceful than she'd intended. "Yeah," Megan agreed. She said it without bitterness, just as a fact. Volk coded 8 minutes later. The monitor alarm changed pitch, and the number on the screen went wrong in a way that made everyone in the bay move simultaneously. Ethan called it, "V-fib, get me the D-fib, now." And the organized response protocol kicked in. Except the AED trolley in Bay 1 had been used during the factory response, and someone had moved it without logging it back to its position. And for 17 seconds, which is a very long time when a heart has stopped, there was confusion about where it had gone. Priya found it in the hallway. They got 2 shocks off. The second one converted him. The monitor went from the jagged chaos of fibrillation to something approaching rhythm, and the room let out a collective silent exhale that wasn't quite relief because he wasn't stable, just no longer in immediate arrest. Ethan straightened. He looked at the monitor, looked at Volk, looked at his hands. "He needs a surgical suite," he said. "We can't manage this down here. Someone get cardiothoracic on the phone." "Cardiothoracic is in surgery," Tyler's voice came over the intercom. "2 of the factory patients. Earliest available is 45 minutes. Ethan said nothing for a moment. Megan looked at Volk. She looked at his color. She looked at the monitor, the trend lines, the numbers that were telling a story in real time. 45 minutes was not a number this situation was going to accept. There's a procedure, she said. The bay went quiet in a specific way. An emergency thoracic intervention. It bypasses the need for a full surgical suite for the immediate crisis. It's not standard ER medicine. She stopped. She was aware of every set of eyes in the room. She was aware of Linda in the doorway, and Ethan at the stretcher, and Garrett against the wall, and Priya 3 feet to her left. But it can stabilize him long enough to get to surgery. What kind of procedure? Ethan said. She told him. She described it clearly and quickly, with the kind of anatomical precision that came from knowing something not from a textbook, but from having done it. Ethan's expression was doing something complicated. He was weighing the information against the source of the information and having some difficulty with the contradiction. "Where did you learn that?" he said. "That also doesn't matter right now." "It matters to me. You're a nurse with 11 weeks on the floor. Who just watched you almost miss an arterial bleed?" she said. She kept her voice level. Not cruel, but done. "He's going to arrest again. You have maybe 10, 12 minutes before his pressure drops below the point where you can manage it pharmacologically. The cardiothoracic team is 45 minutes out. I'm telling you, there's a bridge." She paused. "You can authorize it, or you cannot authorize it. Either way, I need you to decide now." Ethan Ward stared at her. Garrett pushed off the wall. He moved to stand beside the stretcher, and he looked at Megan, and his voice when he spoke was quiet and deliberate. "Calloway?" he said. "Is that your last name?" "Yes." "I'm Calloway." She looked at him. "HMC Calloway?" he said. The room didn't know what that meant. But something in Garrett's face when he said it, not surprise exactly, but a kind of recognition clicking into place, the expression of a man who has just solved a problem he didn't know he was trying to solve, made several people in the bay go still. Megan held his gaze for 3 full seconds. "Authorize the procedure," Garrett said to Ethan. He said it the way people gave orders when they were not asking. "Right now." Ethan looked between them. He was a physician in his own hospital who had just been given a directive by a man in tactical gear he had never met before. He picked up Volk's chart. He signed the authorization. Megan was already moving. She washed her hands at the basin in Bay 1, and her hands were steady in a way that had nothing to do with forcing them steady. They were just steady. They had always been steady when it counted. That was either a gift or a consequence, and she had never decided which. Priya was at her elbow. "Tell me what you need." Megan told her. Priya moved. Garrett came to stand just outside the bay entrance, arms crossed, watching. One of his men had appeared at the door as well. The one who'd been on the phone, a younger man with a shaved head and an expression that was doing its best to stay professional and not quite managing it. "Sarge," the younger man said to Garrett, low, "is that who I think—" "Yeah," Garrett said. "How is she?" "I don't know. Be quiet." Linda Mercer was in the hallway behind them, and her face had taken on an expression that Megan, had she been watching, might have described as the look of someone who has constructed a story about a situation and is now watching that story develop a crack they can't explain. Ethan Ward stood at the edge of the bay. He was supposed to be supervising. He was watching Megan Calloway work, and whatever he'd expected to see, hesitation, overreach, the fumbling of someone performing beyond their training, it wasn't what he was seeing. What he was seeing was someone who was not performing beyond their training at all. What he was seeing was someone performing exactly within it. He just hadn't known what their training was. Volk's monitor held steady through the procedure. Not perfectly. There was a moment 6 minutes in where a number dropped sharply, and Priya's breath caught, and Megan's hands didn't stop moving, didn't speed up, didn't falter, just continued with the particular focused calm of someone who had been in rooms where calm was the only tool that still worked. The number recovered. She kept going. When it was done, she stepped back and looked at the monitor. The numbers were not perfect. They were not the numbers of a man who was going to be fine without surgery, but they were the numbers of a man who was going to make it to surgery, which was the only number that mattered in the next 40 minutes. She pulled off her gloves. Garrett was still in the doorway. He had not moved the entire time. "HMC Calloway," he said. He said it differently this time, but not a question. She looked at him. "Commander Volk is going to want to know you were here," he said. Commander Volk needs to focus on staying alive, she said. Tell him that too, when he wakes up. She walked to the basin and washed her hands again. Behind her, she could hear Priya talking to the monitor tech, could hear the soft, elevated but controlled noise of a trauma bay in the middle of a hard day. Could hear Ethan Ward somewhere to her left saying something to Linda in a voice that was too low for her to make out. She dried her hands on a paper towel and turned around. Director Hale was standing in the bay entrance. He had come down from administration, which meant someone had called him, which meant the situation had escalated to a level that required his physical presence rather than a phone update. He was a man in his late 50s with careful eyes and the specific posture of someone who had learned to measure consequences before he opened his mouth. He looked at Volok, stable on the stretcher. He looked at the tactical team in his ER. He looked at Megan. And before he could say a single word, Garrett stepped forward and said, "Director, my name is Garrett Hollis. I'm with Naval Special Warfare. The man on that table is Commander Darius Volk, and the nurse who just kept him alive long enough to reach surgery." He stopped. He looked at Megan again with an expression that contained something Megan hadn't seen aimed at her in a very long time, something that sat uncomfortably between recognition and respect. "I need to know why she's on suspension." Hale opened his mouth, closed it, looked at Megan. She said nothing. She stood with her hands at her sides and her expression even and waited for whatever was going to happen next. The monitor behind her alarmed. A short, sharp notification tone, not the bad kind, the kind that meant a threshold had been crossed into a better range. Volk's pressure had ticked up another 4 points. Nobody moved for a moment. Then Garrett's phone rang. He looked at the screen. Something in his expression went very flat and very serious. He stepped into the hallway and answered it. Whatever he heard on that call made him turn and look back through the bay doorway at Megan with an expression she couldn't read from across the room, and that unreadability was itself something, because in the 30-odd minutes she had known Garrett Hollis, he had been a man whose face said what it meant. He came back in. He looked at Director Hale. "Sir," he said, "we have a problem." The problem had a name, and its name was incoming. Garrett kept his voice low when he explained it to Director Hale, but the bay was not large and Megan heard every word. A second element of the same maritime operation had gone sideways 40 minutes after the first, a support team that had been holding a perimeter position when something detonated beneath them. 4 additional casualties. 2 critical. ETA to Riverside Valley, 11 minutes because Mercy General's trauma capacity was fully consumed and St. Augustine's had lost power to one of its surgical suites during the factory surge. Riverside Valley was what was left. Hale absorbed this with the expression of a man doing rapid math on a situation that was not adding up in his favor. "Our surgical capacity is—" "I know what your surgical capacity is," Garrett said. "I need to know what your trauma floor can handle before they get here." Hale looked at his floor. He looked at the bays, most still occupied, 2 running double on nursing coverage because the staffing had been stretched since the factory response. He looked at Ethan Ward, who was standing near the monitor station with his arms crossed and an expression that had been cycling between defensive and something more uncertain for the last 20 minutes. Then Hale looked at Megan. She didn't say anything. She was checking the supply count on the mobile cart near the bay entrance, running through what was available versus what 4 additional trauma patients might require, doing the kind of quiet preparatory work that didn't announce itself. "Calloway," Hale said. She looked up. "Your suspension is paused. Effective now." He said it carefully, like a man who was aware he was making a decision he hadn't fully processed, but was making it anyway because the clock didn't care about his processing time. Linda, still in the hallway, made a sound that wasn't quite a word. "Marcus Delvey is in recovery," Hale continued, quieter. "The procedure you performed, the attending on call reviewed it. His outcome would have been significantly different without it." He paused. "We'll discuss the protocol question later. Right now, I need you on the floor." Megan nodded once. She turned back to the cart and kept counting. Garrett watched her. Then he looked at one of his men, the younger one with the shaved head, whose name she still didn't know, and something passed between them that wasn't a word. Ethan Ward walked over to the cart. He stood beside Megan, and for a moment neither of them said anything, and the silence had weight. I'm going to need you to walk me through what you did in there, he said finally. Not as an accusation, something else. Later, she said. We have 11 minutes. He nodded. He didn't argue. That was something. The next 11 minutes were the kind that compressed time in that particular way high-pressure situations had. The minutes themselves didn't speed up, but the space inside them got smaller, denser, until there was only the task in front of you and the task after that, and nothing peripheral at all. Megan pulled Priya and a second nurse named Okafor, third year, quiet, fast hands, and ran a prep briefing that lasted 4 minutes and covered trauma bay assignments, supply positioning, and a simple decision tree for triage if the incoming casualties presented with more complexity than the advance report had indicated. Priya took notes on her wrist with a marker. Okafor didn't need to. Garrett appeared at the edge of the group. 2 of the 4 are ambulatory, walking wounded. 1 has a leg injury that's been field dressed. The other took shrapnel to the arm and back, but the penetration isn't deep. The critical 2 are the ones you need to prepare for. Descriptions, Megan said. First is a blast injury to the abdomen. He's been packaged, but the field team reported organ involvement. They couldn't confirm what. Second, Garrett stopped. His jaw shifted. Second is a head injury. Blast concussion plus a structural impact. He was unconscious when they loaded him, and he seized once in transit. Megan looked at him. Age? 26, but she kept her face even. Okay. Garrett held her gaze for a beat. His name is Kellner. He's been in the unit 4 years. It was the first time she'd heard any of them use a name other than Volks. She understood what that meant. That Garrett was telling her this was someone specific, someone who mattered to the people bringing him in, and that he was asking her, without saying it directly, to know that. I hear you, she said. He nodded. The ambulances came in at 2:47 p.m., and the sound of them arriving, 2 rigs simultaneously, both pulling hard into the bay, paramedics already at the rear doors before the vehicles had fully stopped, shifted the ER into a different register entirely. Not louder exactly, tighter. The abdomen case went to Bay 3 with Ethan and Okafor. The head injury, Kellner, went to Bay 1, the largest space, the one where Volk had been stabilized and where the equipment was already positioned. Megan took Bay 1. Priya was with her. She had 3 seconds to look at Kellner before she started working. 26 years old. He was big, the build of someone who had spent years carrying weight and moving fast under it. His face, under the field dressing on his left temple, was slack in the specific way of a head injury that had disrupted the brain's surface function. Not dead slack, but absent in a way that was hard to describe to anyone who hadn't seen it. His chest was moving. That was the first thing she always checked, and it was moving. GCS, she said to the paramedic transferring care. 7 on scene, dropped to 5 in transit. Pupils unequal. Right is blown, left is reactive. A blown pupil on the right meant pressure on the right side of the brain. Pressure meant swelling or bleeding or both. Swelling and bleeding in a closed skull meant time was the variable they could not negotiate with. Seizure activity since the first one, she said. None confirmed, but he was posturing briefly about 6 minutes ago. Decerebrate. Decerebrate posturing meant the brainstem was involved. It meant the pressure wasn't superficial. Megan pulled on fresh gloves and went to work. She moved through the assessment in the sequence she had been trained to use in environments where there was no backup and no second opinion, and the only reference material was what she carried in her own head. Airway, breathing, circulation, neurological, each one assessed with hands and eyes and the stethoscope and the particular tactile knowledge that didn't come from classrooms. She called findings aloud as she went so Priya could document in real time, which was not how she'd been taught to work in this hospital, but was how she'd been trained to work in environments where documentation happened simultaneously because there wasn't a pause to catch up later. Priya kept up. She didn't ask Megan to slow down, she just kept up. Pupils, Megan said, pen light moving. Right non-reactive, left sluggish. Cushing's triad presentation, BP's elevated, pulses dropping, breathing pattern is irregular. He's herniating. What does that mean? Priya said. She asked it not from ignorance, but because she was documenting and she needed the language. The brain is being pushed through the base of the skull by pressure. It's survivable if we reduce the pressure. It's not survivable if we wait for neurosurgery to have an opening in their schedule. Priya wrote it down. Her handwriting was small and fast. Get me the mannitol from the cart, and I need neurosurgery paged, whatever it takes. If they're in surgery, I need someone on the phone who can walk me through options. Neurosurgery is Dr. Farrant, Priya said. She's in OR2 with one of the factory patients. Get her on the phone. Not a resident. Her. Priya went. Megan elevated Kellner's head 30 degrees, started the IV line, called the mannitol dosage to the monitor tech across the bay. She was in the specific state she had no good word for. Not calm exactly. Not adrenaline exactly. Something that was a third thing. The place where training and urgency converged and produced a quality of focus that felt almost like detachment, but wasn't. She was completely present. She simply wasn't letting anything that wasn't immediately relevant into the space. Garrett appeared in the bay doorway. She didn't look up. He's herniating. We're working on it. You can stay, but you cannot talk to me for the next several minutes. Copy, Garrett said. And he was quiet. That was the thing about people who had spent time in operational environments. They understood when talking was and wasn't a useful contribution. Priya came back 4 minutes later with a cell phone. Dr. Farrant, she can talk between stapling. Megan took the phone. She described Kellner's presentation in 30 seconds. Clinical, precise, no qualifiers that wasted time. Dr. Farrant, to her credit, did not ask who she was talking to or why a nurse was calling her mid-surgery. She listened, asked 2 clarifying questions, and then gave Megan a set of options in descending order of her preferred approach. The first option required equipment that was in OR2 with Farrant. The second option required a specific pharmacological combination that bought time, reduced intracranial pressure long enough to either get Farrant out of her current case or get Kellner moved. The third option was what you did when the first 2 had failed. Megan thanked her and handed the phone back to Priya. Second option, I'll tell you what we need. They worked. The mannitol was running. She added hyperventilation support through the bag valve mask, controlled at the rate that Farrant had specified. Not faster, because faster wasn't better, because there was a narrow window between therapeutic and harmful, and she knew exactly where it was. She reassessed pupils every 4 minutes. She talked to Kellner, even unconscious, not because she thought he could hear her, but because it kept the energy in the bay from going to the cold, clinical place that sometimes made everything worse. You're in Havenport, she said, adjusting the IV rate. You made it out of the water. You're in a hospital, and we're handling it. Garrett made a sound from the doorway that might have been the start of something and then wasn't. 15 minutes in, Kellner's right pupil responded. Barely. A flicker, not a full reaction, but a response where there had been none. Megan saw it and made herself not react outwardly because outward reactions in a bay consumed energy that belonged to the patient. His pressure's dropping, the monitor tech said. 158/92. Still high, but trending. The right direction. Priya exhaled. Don't celebrate yet, Megan said. Not unkindly. Right. 22 minutes after Kellner had arrived, Dr. Farrant walked into Bay 1 still in her surgical gown, mask pulled down around her neck, and assessed the patient with the speed of someone who had been pre-briefed by the phone call and was picking up mid-sentence. She checked his pupils herself. She looked at the monitor. She looked at Megan's documented interventions on the tablet Priya handed her. Farrant was 50, silver-haired, and had the reputation of someone who did not waste words on anything that wasn't medically relevant. Who initiated the hyperventilation protocol, she said. I did, Megan said. Farrant looked at her, looked at the badge. Callaway, RN. Yes. The rate is exactly right, Farrant said. It was not a compliment in tone. It was an observation, but it was accurate, and accuracy from Farrant apparently substituted for warmth. He needs to go upstairs. I can take him in 40 minutes. Keep doing exactly what you're doing. She left. Priya looked at Megan. She didn't say anything. She didn't need to. Outside Bay 1, the floor had reached a new state. Not resolved, but held. The immediate surge was managed. The critical cases were either in surgery or stabilized, and the ER had the quality of a team that had been running at full speed and was now running at 3/4, which felt almost like rest. Almost. Megan walked out of the bay to get water from the break room. She'd been in Bay 1 for over an hour, and she hadn't noticed until she was standing in the corridor, and her body reminded her of several things at once. She was in the break room pouring water when she became aware that she wasn't alone. Linda Mercer was at the table. She had a cup of coffee in front of her that she wasn't drinking. Her clipboard was beside her, but she wasn't holding it. She looked like a woman who had been sitting somewhere quiet trying to resort information that had rearranged itself without her permission. She looked up when Megan came in. They looked at each other for a moment. Linda said, "The procedure you did on the Delvey patient this morning." She stopped, started again. "The thoracostomy." "Yes," Megan said. "I reported you for that." "I know." "He would have died." Linda said it carefully, as if the words needed to be placed rather than spoken. Megan drank her water. She didn't answer that because it wasn't a question. Linda's jaw moved. "Where did you learn to do those things? The procedure in Bay 1 just now? The protocol you ran?" "Linda." Megan set down the cup. She kept her voice even. "I'm going to go check on my patients." She walked out. Garrett was waiting in the corridor. He had the look of a man who had been in the building long enough to have developed a working understanding of its layout, and he was positioned where the corridor from the break room met the main ER floor in a way that was not accidental. "Can I talk to you for a minute?" he said. "Sure." He walked her a few steps away from the flow of traffic. He was quiet for a moment, the way he'd been quiet when she'd told him not to speak in the bay, deliberate rather than uncertain. "You said your name was Calloway," he said. "M. Calloway. I've been going through it since I said your name in there." She waited. "Megan Calloway, HMC, Hospital Corpsman Master Chief, SEAL Team 8, 3 deployments, 2 in the Strait, 1 classified." He wasn't reading from anything. He was reciting it from memory, which meant it was not information he'd looked up in the last hour. It was information he'd already had. "You were cited for a field intervention in the Strait that kept 4 operators alive long enough for medevac. The after-action report described the intervention as, and I'm quoting someone else here, beyond the assessed capability of any corpsman in theater." He stopped. "That was 6 years ago." Megan said nothing. "After that deployment, you separated from service. No formal discharge documentation on file that I've been able to pull. It was processed through a channel I'd need clearance to access." He looked at her directly. "And then you became a nurse at a mid-sized ER in Havenport, Ohio." "I became a nurse at a mid-sized ER in Havenport, Ohio," she confirmed. "Why?" She thought about how to answer that. She considered several versions. She chose the true one because it was also the shortest. "Because I needed to be somewhere quieter for a while." But Garrett absorbed that. He didn't push it. People who had done what she had done and then stepped away, he understood something about that. She could see it in his face. He didn't understand her specific reasons, but he understood the shape of them. "Volk is out of surgery," he said. "They moved him to post-op 20 minutes ago. The surgeon said the bridge procedure you did bought him the time he needed. Without it," he stopped. "He's going to make it." She nodded. "He's going to want to thank you himself when he's able." "He doesn't need to." "I know he doesn't need to." Something in Garrett's voice shifted. "I'm telling you he's going to want to." She looked at him. There was nothing hostile in his expression, nothing she needed to defend against. There was just the straightforward regard of someone who had spent a career working alongside people who were exceptional at dangerous things and had learned to recognize what that looked like when it was standing in front of him. She was about to respond when Priya appeared at the end of the corridor, moving quickly. Not running, but the walking fast of someone who had news and understood that news needed to travel at a certain speed. "Kellner," Priya said when she reached them. Megan turned to face her fully. "He's seizing again. Different presentation. It started in his left side." Priya's voice was controlled, but her eyes were not quite. "Dr. Ferrant's been paged, but she's still in OR2, Megan said. "There's a second neurosurgeon coming in, but he's 20 minutes out. The resident on call is in Bay 1 right now, but Megan, he doesn't know what he's looking at. I can see it. He's standing at the bedside and he's reading the chart and he doesn't." Megan was already moving. She came through the Bay 1 doorway and read the room in 3 seconds. The resident, she didn't know him, young, 2nd or 3rd year from the look of him, standing with the chart in a way that confirmed what Priya had said, looked up at her with an expression that contained more relief than it should have from a physician greeting a nurse. Kellner was in a focal seizure, left side, his left arm and leg moving in the rhythmic, involuntary pattern that meant the electrical storm was localized but not controlled. His monitor showed his oxygen saturation dropping. Megan went to the bedside. "Lorazepam?" she said to the resident. Yes, I was going to order it now, 2 milligrams IV, and I need a repeat neuro check on his right pupil immediately." The resident reached for the order system. Megan did the pupil check herself. The right pupil, which had flickered responsively 20 minutes ago, was blown again. Fully blown, fixed and dilated. She stood at the bedside with the pen light in her hand and looked at the number on the pupil and understood what it was telling her. And what it was telling her was that the pressure that had been temporarily managed was no longer managed, and that the window of time that Dr. Ferrant had said she had 40 minutes to use had just narrowed dramatically. She looked at the clock on the bay wall. She looked at the door. She looked at Kellner's face, 26 years old, slack with the particular absence of a brain under too much pressure, a man who had survived whatever had happened in the water and made it 11 minutes in an ambulance and an hour of intervention, and was now at the edge of a line that once crossed did not uncross. She heard Garrett's voice from the doorway behind her, very quiet. "Calloway." She didn't answer him. She was running the numbers in her head. Time to Ferrant, time to the incoming neurosurgeon, time that Kellner had, which was not the same number as either of those and was shrinking in a direction she didn't like. She put down the pen light. She looked at the resident. "Get Director Hale on the floor," she said. "Right now." The resident looked at her. "Why?" "Because I'm going to need authorization for something," she said, "and I need it in the next 4 minutes." Director Hale arrived in Bay 1 in under 3 minutes, which told Megan that someone had been keeping him close to the floor rather than letting him retreat back upstairs to administration, where the noise was manageable and the decisions were slower. He came through the door and read the room the same way she had. The seizing patient, the monitor numbers, the resident standing with the chart like a man holding a document in a language he could partially read, and Megan at the bedside with the pen light still in her hand and an expression that had resolved into something very specific and very still. "What do you need?" Hale said. No preamble. She respected that. "Kellner's pressure has rebounded. His right pupil is blown again. Ferrant is 20 minutes from being available, and the neurosurgery backup is the same. He doesn't have 20 minutes, not without intervention." "What kind of intervention?" She told him. She described it in the same clinical shorthand she'd used with Ethan earlier, but she was looking at Hale directly this time, not working around anyone's ego, just delivering information to the person who had the authority to do something with it. Hale's face was doing the calculation she'd watched it do twice before today. The institutional risk against the human cost, the liability column against the column that contained a 26-year-old on a stretcher. "Can you do it safely?" he said. "Safely is relative. It's the best option currently available." "That's not the same as yes." "No," she agreed. "It's not." He looked at Kellner. He looked at the monitor. He looked at the resident, who had the decency to offer nothing, because there was nothing useful he could offer right now, and he apparently knew it. "Authorize it," Hale said. "I'll sign whatever needs signing after." She was already moving before he finished the sentence. What followed was 23 minutes that Megan would not think about much afterward. Not because they were forgettable, but because there was nothing about them to revisit. She had been trained to do what she did. She had done it, and the outcome was either going to be one thing or another. Thinking about it later didn't change what had happened. That was a feature of training, not a deficiency of feeling. Priya was steady throughout. She anticipated, she handed things without being asked twice. She monitored the oxygen without being reminded. She made one mistake, drew up the wrong concentration on one medication, caught it herself before Megan had to, corrected it without comment, and moved on. It was the kind of mistake a good nurse made when they were working at the edge of their experience and were self-aware enough to catch it. Megan didn't mention it afterward. The seizure activity ceased at the 14-minute mark. Kellner's left side went still. Not the stillness of death. The monitor held, his breathing held, but the stillness of a brain that had been given enough relief to stop firing in the disordered way it had been firing. At 21 minutes, His right pupil showed a response. At 23 minutes, Dr. Ferrant walked through the bay one door. She assessed in 30 seconds and said, "Get him to prep. I'm taking him now." Then she looked at Megan with the specific expression of someone who has arrived to find that the work they were called to do has already been partially accomplished. "You bought him another window," Ferrant said. "He earned it," Megan said. "He just needed someone to hold it open." Ferrant made a sound that, from her, apparently constituted acknowledgement. Then Kellner was moving, stretcher wheels, team in motion, Priya walking alongside until the OR corridor took over. And Bay 1 was suddenly quiet and the weigh rooms went quiet after something large had passed through them. Megan stripped her gloves. She stood at the basin and washed her hands for the 4th time that day, and her hands were still steady, which she noticed the way you notice something that had become so constant it was almost invisible. Garrett was in the doorway. He'd been there the whole time, she realized. Every time she'd looked up, he'd been in the doorway, watching with the particular stillness of a man who understood that his presence was permitted only as long as it cost nothing, and had honored that understanding precisely. "He's going to make it," Garrett said. It wasn't a question. "I don't know that," she said, "but he's got a better chance than he did 40 minutes ago. That's enough for me." She dried her hands and turned around, and the corridor beyond Garrett's shoulder was visible. And in that corridor, she could see the ER floor, still running, still occupied, the Tuesday afternoon shift that had become something none of them had clocked in expecting. She could see Priya emerging from the OR corridor doorway, walking back toward the floor. She could see Okafor in Bay 3, still working. She could see Tyler at the charge desk with his headset on, managing something. She could also see Ethan Ward standing near the nursing station, and Linda Mercer beside him, and the fact of them standing together had a quality that she recognized as the configuration of people who had been having a conversation they hadn't finished when circumstances interrupted it. She walked out of the bay. The floor registered her the way a room registers when someone walks in whose presence has accumulated weight over the course of a day. Not every head turned, people were working, but enough of them did that she was aware of it. She went to the nursing station to update Kellner's chart. She did it methodically, in the correct sequence, because the chart was the record, and the record mattered regardless of everything else. Ethan moved to stand beside her. She kept writing. "The intervention," he said. "In Bay 1. The second one." "Yes." Ferrant called it a field procedure. Said she'd only seen it documented in military after-action reports and one training manual from a special operations medical program. Calloway. He waited until she looked up. "I'm not coming at you. I'm trying to understand what I've been looking at all day." She studied him for a moment. He looked different than he had this morning. Not diminished exactly, but compacted, like something in him had been pressed down by the weight of the day into something smaller and more honest. "You've been looking at someone who was trained differently than you were," she said. "That's all." "It's not all," he said. "I'm a physician. I have a medical degree and a residency and 11 years of ER experience. What you did today? I couldn't have done that." She put down her pen. "Some of it you could. You caught the arterial bleed once I pointed you to it. You managed Volk's initial presentation. You're not a bad physician, Dr. Ward." "But," she looked at him directly, "you've spent 11 years in a hierarchy that told you where you sat in the room, and you accepted that as a fact instead of a habit." She picked up the pen again. "That's not a medical problem." He was quiet for a moment. She could feel him processing it, not defensively, which surprised her. There was something raw in his expression that she hadn't seen from him before. Not comfortable to look at. Probably not comfortable to feel. "I told Linda the Delvey procedure was reckless," he said. "I told her in front of the nursing station." "I know. I was wrong." She wrote the next line of the chart. "I know that too." He waited, apparently expecting something more. An acceptance, a release, something that completed the exchange. She didn't provide it, not because she was withholding it, but because she didn't have the bandwidth right now for the emotional labor of making him feel better about something he'd done wrong. She was tired. She had been in this building for 8 hours and had performed more interventions in that time than most nurses at this hospital performed in a month, and her back hurt. and she was out of coffee, and she was still on what was technically a suspended employment status, paperwork-wise. She finished the chart update and moved on. The afternoon pressed forward the way afternoons in surge capacity ERs did. Not resolved, not clean, but managed. The factory casualties were moving through the system. The 2 walking wounded from the SEAL team had been treated and were sitting in a patient room, both declining admission, both asking about their teammates with the specific insistent loyalty of people who would not rest until they had a status on every member of their unit. Garrett updated them himself. Megan heard him through the open door. Direct, factual, no emotional inflation in either direction. Volk was in post-op and stable. Kellner was in surgery and fighting. That was the truth, and he gave it to them without softening it, and they received it without flinching, which was how those exchanges went. She was outside the supply room at 4:30 p.m. when Linda found her. She had been expecting this. Linda had been orbiting her peripherally for the last 90 minutes, with the energy of someone who had something to say and was waiting for the right conditions to say it. Those conditions were never going to be perfect, and they both knew it. "I filed the report this morning," Linda said. She meant the suspension report, the formal documentation she had submitted to Hale and HR. "I filed it before the helicopter arrived." "I know when you filed it," Megan said. "I want to—" Linda stopped. She pulled her clipboard against her chest in the habitual gesture that Megan had stopped interpreting as authority and started interpreting as armor. "I filed it based on what I observed, which was a nurse performing a procedure outside her scope and outside her authority. At the time, I had no reason to bend—" "Linda," Megan kept her voice even, "are you apologizing or are you explaining?" Linda's jaw tightened. "Both." "Okay." Megan leaned against the wall. "The problem isn't that you reported it. The problem is that you watched me work for 11 weeks and decided on week 3 what I was. And after that, everything I did got filtered through that decision. The double-checking wasn't thoroughness. It was slowness. The questions weren't clarification. They were incompetence." She wasn't raising her voice. She wasn't angry, exactly. She was past the phase of the day where anger was available. "Mrs. Doran in Bay 7 this morning. I told you the drip rate was correct and you told me to adjust it anyway because you didn't trust my assessment." Linda said nothing. "I adjusted her pillow positioning and her arm placement and spent 6 minutes talking to her because she was terrified and alone. Her pain reduced on its own. When I came back an hour later, the drip rate was exactly where I'd left it." Megan looked at her. "You had 14 years of experience telling you what a good nurse looked like. The problem is that what you saw didn't match your picture." "I was wrong about you," Linda said. "It came out compressed, like it had traveled a long way to get out." "You were wrong about what you saw," Megan said. "That's different." She pushed off the wall and went back to the floor. At 5:15 p.m., Director Hale called a meeting. Not in the conference room. There wasn't time or capacity for that. But in the physician's lounge, which was large enough to hold the relevant people. He asked for Megan, Ethan, Linda, Garrett, and 2 HR representatives who had apparently been in the building since early afternoon, which told Megan they'd been called in during the factory response and had been doing their own assessment of the day's events. She sat in one of the chairs along the wall. She was the only one who chose a wall chair. Everyone else took the table. Hale started by saying that Riverside Valley had experienced an unprecedented mass casualty event compounded by a secondary military incident, and that the hospital's response had been, he paused, uneven. That was diplomatic. She gave him credit for it. He then said that in the course of that response, a member of the nursing staff had performed multiple high-acuity interventions that had materially altered patient outcomes. He named the interventions. He named the patients. He used the word materially twice, which in administrative language meant the difference between alive and not alive, without using those specific words. He then said that the same nurse had been placed on suspension earlier in the day, based on a report submitted to him by the charge nurse and supported by the attending physician on duty. He looked at Linda. He looked at Ethan. He looked at the HR representatives, one of whom was writing. "I want to be clear about the timeline," Hale said. Ms. Calloway was placed on suspension and then performed 3 additional interventions while technically on suspended status, each of which I personally authorized in real time due to patient need. The suspension did not reflect accurately on her capability. It reflected... He paused again, choosing words. It reflected an assessment based on incomplete information about her background and training. Her background, one of the HR representatives said, which is? Garrett opened a folder on the table. Megan had not seen him carrying a folder. She didn't know when he'd acquired one. With the facility director's permission, Garrett said, and Hale nodded. Megan Calloway served as a hospital corpsman master chief with Naval Special Warfare for 9 years. She completed 3 combat deployments, 2 in active theater. She holds advanced training certifications in emergency trauma care, tactical combat casualty care, and emergency surgical assistance. She was cited for a field medical intervention in the Strait of Balaran 6 years ago, that is, and I can provide documentation, the reason 4 members of a SEAL team are alive today. He looked up from the folder. She separated from service 3 years ago and completed a civilian nursing credentialing program 18 months after that. Her credentials are fully valid and current. The HR representative looked up from her notes. Why wasn't this in her application file? Because I didn't put it there, Megan said. Everyone looked at her. My military service is my background. It's not my credential here. I applied for a nursing position, I hold a nursing license, I have a current certification, I wasn't required to disclose my service history and I chose not to. She kept her voice flat. Not combative, just factual. That was my choice, and it was a legal one. Ethan Ward had been quiet since the meeting started. He spoke now, and his voice was different from his morning voice. The authority still there, but carrying something else underneath it. Something that had the quality of a man who had been taking inventory and didn't like all the results. I told this morning's charge nurse that Calloway's suspension was appropriate, he said. I supported it. I want that on the record. He looked at the HR representative who was writing. Because I think what should also be on the record is that I made that judgment before I had any understanding of who I was dealing with, and that my support for the suspension reflected my own assumptions rather than her actual performance. The room was quiet. Linda was looking at the table. The clipboard was on her lap. She wasn't holding it. Ethan, one of the HR representatives said, I need to ask you about the Delvey case this morning, specifically your characterization of Ms. Calloway's intervention as reckless in front of other staff members. Ethan's expression shifted slightly, not defensive, but aware. He'd known this was coming. You could see that he'd known it. That characterization was inaccurate, he said. Did you use those words? I used words to that effect, in the nursing station, where several staff members were present. And the patient outcome? Positive. The patient's outcome was positive. He paused. The patient's outcome was positive because of what she did. The HR representative wrote. Linda looked up from the table. I want to say something. She waited, and when no one stopped her, I submitted the suspension report. I stand by the procedural basis for it, because at the time the procedure was outside the visible scope of a registered nurse, and there was no physician authorization on record. Procedurally, that report was correct. She stopped. But I also want to say that in the weeks prior to today, I made Ms. Calloway's position on this floor more difficult than it needed to be. I made assessments about her capability that were not supported by her actual performance, and I acted on those assessments in ways that were not fair. She said it stiffly, like each word was being paid for from a limited supply. That's what I want on the record. Megan looked at Linda across the room. Linda looked back. It wasn't a warm exchange. It wasn't resolved. But it was true. And truth was what was available right now, and she accepted it. Hale set his hands flat on the table. Here is where we are. Ms. Calloway's suspension is rescinded effective immediately. The formal report will be amended to reflect the medical authorization that was granted for each intervention. HR will conduct a review of today's events, and I expect a full report within 2 weeks. He looked at Ethan. Dr. Ward, your characterization of a colleague's performance in a public staff area will be addressed through the physician conduct review process. That review will begin this week. He looked at Linda. The charge nurse report will be retained in the file along with the full context of today's events. Ms. Mercer's position will be subject to a separate performance review based on the pattern of conduct described. He looked at Megan last. I owe you an apology, he said. Not for running the process. The process is what it is, for running it without asking a single question about who you were before I signed the paperwork. Megan held his gaze. Thank you for authorizing the interventions in real time, she said. That was the part that mattered. Hale almost smiled. It didn't quite get there, but it was close. The meeting broke at 5:49 p.m. People filed out. Garrett caught her eye on the way through the door and gave her a single nod. Not the satisfied nod of someone who had watched a performance, but the specific nod of someone who recognized something in another person and was acknowledging it without dressing it up. She nodded back. The floor was quieter by 6. Not quiet. It was an ER. It was never quiet, but manageable. The kind of shift energy that meant the crisis had been held and now the ordinary work was reasserting itself. She was updating Kellner's pre-surgical chart at the nursing station when Priya appeared beside her and said, without preamble, He's out of surgery. Megan looked up. Ferrant just called down. He's in recovery. She said the intervention you did, the second one in Bay 1, she said it was the specific reason the surgery was viable. If the pressure had rebounded to where it was trending, she wouldn't have been able to operate. Megan went back to the chart. She wrote the next line, and the one after that. Priya watched her. You're not going to say anything? He needs to wake up before I say anything, Megan said. I'll say something when he wakes up. At 7:22 p.m., Megan was in the corridor outside the recovery unit when the door opened and a nurse she didn't know poked her head out and said, Calloway? Commander Volk is asking for you. She went in. Volk was propped at 30 degrees, pale and tubed down and carrying the general appearance of someone who had been through something significant and was just beginning to understand the scope of it. He was big even in a hospital bed. The frame of him occupied space. His eyes were open and tracking, which was what mattered. He looked at her for a moment before he spoke. His voice was rough from the airway work, careful with each word. They told me what you did, he said. Don't strain your voice, she said. They told me who you are. She pulled the chair beside his bed and sat. Not because she owed him the conversation, but because he'd earned the right to have it. Garrett told me about the Strait, Volk said. I had friends on that team. She looked at him. 2 of them are still in the service. 1 retired last year. They talked about the corpsmen who kept them alive until extraction. The way they described it, he stopped, adjusted his breathing. Nobody knew where you went afterward? I didn't go anywhere, she said. I came here. He seemed to be turning that over. Why here? It was the same question Garrett had asked. She gave him the same answer because it was still the true one. Because I needed somewhere quieter for a while. Volk looked at the ceiling for a moment. Is it quiet enough? She considered that. She thought about the morning, the factory, Marcus Delvy's cyanotic lips, the helicopter coming in over the parking lot, Kellner in Bay 1, Hale's hands flat on the conference table. No, she said, but it's mine. He made a sound that might have been a laugh, except it cost him something, and he stopped it. He looked at her again with eyes that had the particular focus of someone whose energy was very limited and who was choosing carefully what to spend it on. The hospital's going to hear about this, he said. What you did today. People are going to ask questions. They already are, she said. And I'll answer them. She stood. Rest. Your pressure held through surgery, and that's what I care about right now. Everything else is tomorrow's problem. She walked to the door. Calloway, Volk said behind her. She turned. Garrett said you called yourself a nurse at this hospital. That's what you said when he asked who you were. She waited. He said you didn't say anything else. Volk's voice had something in it that she couldn't quite name. He said that's what made him start thinking. She looked at him across the room. Get some sleep, Commander. She went back to the floor. The ER had settled into its evening rhythm. New patients, different faces, the ordinary triage of ordinary emergencies that formed the actual texture of the work. She took a bay assignment from Tyler, who handed her the clipboard without commentary but held it a second too long in the handoff. which was his version of saying something without saying it. She took it and went to work. She was mid-assessment on a 14-year-old who'd broken 2 fingers at soccer practice when her phone buzzed in her pocket. She ignored it. She splinted the fingers, explained the follow-up care to the mother, and made sure the kid wasn't trying to minimize the pain because she'd seen that before in athletes, and it always ended badly. She checked the phone in the corridor after. A text from a number she didn't recognize, which was unusual because almost no one had this number. The text said, "Confirmed receipt of today's incident report. Naval Special Warfare Medical Affairs will be sending a representative to Riverside Valley Thursday morning. Formal commendation process to begin per regulation. Commander M. Hollis, NSW Medical." She read it twice. Then she checked the name again. Hollis. Not Garrett. Commander M. Hollis. Which meant the man she'd known as Garrett all day had a rank and a full name and had apparently gone back to his vehicle at some point and made a call that she had not anticipated and had not been asked to authorize. She stood in the corridor for a moment with her phone in her hand and the very specific feeling of someone who had spent 3 years constructing a particular quiet life and had watched it, in the course of one shift, become something else. She put the phone in her pocket. She went back to her patient. At 8:47 p.m., she came out of Bay 4 and found Ethan Ward waiting in the corridor, not hovering, standing with the specific deliberate stance of a man who had decided to be somewhere and was going to be there regardless of how long it took. "The physician conduct review starts Friday," he said. "I know. I'm going to tell them what I told the meeting." He paused. "All of it." She looked at him. "Ethan, you're a decent physician. You're going to be a better one after this than you were before it. That's what's supposed to happen." He absorbed that. She could see him absorbing it, not dismissing it, not making it larger than it was, just taking it in as what it was. "I owe you more than that," he said. "Maybe," she said. "But this is what's available right now." She moved past him. She had 2 more patients on her board and a medication reconciliation to finish before her shift ended, and the work didn't pause for consequences, which was one of the things she had always appreciated about it. She was at the nursing station, head down, when the main ER doors opened and Tyler's voice carried across the floor with a quality that made her look up without deciding to. "We've got incoming," Tyler said. "Multi-vehicle accident on the 77 overpass. 6 confirmed, 2 critical." He was already picking up the phone. "All available staff to trauma." Megan put down her pen. She was already moving when she heard the first ambulance bay doors open, and behind her she heard Ethan's footsteps fall in alongside hers, and then Priya's, and then Okafor's, and the 4 of them moved toward the bay together with the specific, purposeful rhythm of people who had spent a long and brutal day learning exactly what they could do when it was required of them. But before they reached the doors, Tyler called out one more thing, something that had come in on the secondary line, something that made the charge desk coordinator's voice go careful in a way that stopped Megan mid-step. "Calloway," Tyler said. "One of the incoming vehicles, the registration is flagged. It's coming up under a federal law enforcement marker." She turned and looked at him. "And dispatch says one of the first responders on scene is asking for you specifically, by name." She didn't stop moving. The question of who was asking for her by name at the scene of a federal vehicle accident on the 77 overpass was a real question, and she would get an answer to it, but it was going to have to wait until she'd handled what was coming through those doors. That was how this worked. The incoming need was always more immediate than the pending mystery. "How far out?" she said to Tyler. "First unit is 2 minutes. Second is 4. Get me Okafor in Bay 2 and whoever's free in Bay 3. Priya, you're with me." She went to the bay. The first ambulance pulled in at 8:51 p.m., and the patient it carried was a woman in her mid-40s with a seatbelt laceration across her chest and a left arm that had the wrong geometry to it, the kind of fracture that happened when someone braced against impact and the force won. She was conscious and furious about it, which Megan took as a good sign. Conscious and furious meant her brain was running. "My name's Calloway. I'm your nurse. What's your name?" "Dorinda. Dorinda Vance. Is my husband?" "The team outside is taking care of everyone. What I need from you right now is to stay with me."
Does your chest hurt when you breathe? Yes. Yes, Is it my ribs? We're going to find out. Hold still. It was 2 fractured ribs and a clean humeral fracture and a laceration across the sternum that looked worse than it was. Megan worked through it in sequence, kept Dorinda Vance talking because talking kept her from going somewhere frightened and internal, and had her stable and waiting for orthopedics within 18 minutes. The second patient was worse. Male, late 30s, driver of the flagged vehicle, and the paramedic who brought him in was a man she didn't know who handed off the report in a tight, controlled voice that told her he'd seen something out there that he was still processing. Blunt abdominal trauma, possible splenic involvement. He was in and out at the scene, came back around in the rig, BP dropped twice in transit. The paramedic paused at the bay entrance. He's a federal agent. There are 2 others on scene who weren't injured. They've been asking about the hospital he's going to. Now they know, Megan said, already gloved, already at the stretcher. Thank you.
She ran Bay 2 with Ethan for the next 31 minutes, and it was different from the morning in a way she noticed but didn't have time to examine. Ethan listened when she said something, not deferentially. He was still the physician in the room, and he made the calls. But without the reflex dismissal, without the expression that had previously accompanied her input, the one that moved across his face like a screen dropping between what she said and what he heard. He just listened. He was a different version of himself than he'd been 12 hours ago. And it wasn't a complete transformation because those didn't happen in 12 hours, but it was a real shift. She'd seen this before. The particular recalibration that occurred when someone's framework for a situation was comprehensively contradicted by the evidence. Some people never recalibrated. Some people did it slowly and badly. Ethan was doing it imperfectly and in real time, and she had enough human charity left in her after everything to appreciate that. The agent, his name was Pharaoh, she got it from his ID when she cut away his jacket, stabilized after 40 minutes. The splenic concern was real. He needed imaging and likely surgery, but he was stable enough to get there, and that was the bridge, always the bridge. She came out of Bay 2 at 9:34 p.m., and the man waiting in the corridor was not someone she'd expected. He was tall, close to 60, wearing a jacket over a collared shirt with the specific non-uniform of someone who was official but not in uniform by choice. He had a federal ID clipped to his lapel. Not the same agency as Pharaoh's, so she'd registered that in the 30 seconds she'd had with the ID. Different seal. He looked at her badge. Calloway? Yes. Special Agent in Charge Roland Presser, Federal Bureau of Organized Crime Division. He said it without theater. Agent Pharaoh is my man. I was on scene when they loaded him. He paused. I've been told you're the nurse who's been running this ER floor today. I'm one of the nurses on this floor today, yes. I've been talking to a Commander Hollis from Naval Special Warfare for the last 20 minutes. He speaks highly of you. Presser looked at her with the assessment of someone accustomed to reading people quickly and acting on what he read. I'd like to speak to the hospital director when he's available, and I'd like to speak to you. Director Hale is upstairs. I'll send someone to find him. She looked at Presser evenly. And you can speak to me now if it's quick. He almost smiled. It's not quick, but the short version is that the vehicle Agent Pharaoh was driving was involved in an operation tonight that connects to an investigation we've been running for 14 months. Some of the details of that investigation, he stopped, chose his next words. Some of the details have become relevant to certain events at this hospital over the past several weeks. Megan looked at him. Specifically, Presser said, relevant to this hospital's administrative records. Supply billing, procurement contracts, a pattern of documentation that our forensic accounting division has been reviewing since April. She was quiet for a moment. That's not a medical matter. No, he agreed. It's not. But the people involved are, in some cases, people with positions at this hospital. And given what happened here today, he paused again. Given the visibility of today's events, and the fact that a Naval Special Warfare formal commendation process is now on record, I think the timing matters. She studied him. You're telling me this because you want me to know it's happening.
I'm telling you this because the people who filed paperwork against you today are the same people whose names appear in financial records we've been reviewing since April. He said it plainly, like he'd decided she was someone who could handle a plain sentence. That's not the reason for the investigation, and you're not part of it, and this conversation isn't an interrogation. I just thought you should know what you've been working inside of. The corridor was quiet. Somewhere behind her, the ER continued its evening. Monitors, footsteps, the low hum of a hospital that never actually stopped. She thought about Linda's clipboard, the performance review threats, the way the suspension paperwork had moved so fast, faster than she would have expected for a first incident, faster than procedure typically allowed. She thought about the supply cabinet she'd restocked herself that morning because it hadn't been logged correctly. She thought about several other things she'd noticed in 11 weeks and filed away as institutional inefficiency. I see, she said. We'll be speaking to Director Hale tonight, Presser said. We'll be speaking to others over the next several days. I wanted you to have context before that process begins, because you're likely to be asked questions as a witness. He held out a card. Anything you remember, any documentation you have, any observations from your time on this floor. She took the card. She went to find Tyler to send someone up for Hale. The next hour unfolded the way institutional reckonings always did. Not dramatically, not with the clean resolution of something scripted, but incrementally and uncomfortably, the way real consequences arrived. Presser and 2 other agents met with Hale in the administrative conference room. She wasn't in that meeting. She was on the floor, doing her job, which was what she had come to this hospital to do and what she continued to do while the larger structure shifted around her. At 10:45 p.m., she was told by Tyler, who had the wide-eyed energy of someone who had absorbed more significant information in one day than in his previous 3 years at this job, that Linda Mercer had been escorted from the building by Presser's people. Not arrested. Asked to come in for questioning. The distinction mattered legally, Tyler said, as though he had become an expert in federal procedure in the last 40 minutes. She didn't respond to that. She updated her charts. At 11:10 p.m., Ethan found her in the break room. He came in, poured himself coffee, and stood at the counter with his back to the room for a moment, and she understood that he was collecting himself before he turned around. He turned around. The financial investigation, he said. Presser's people were asking about the procurement contracts, the ones that went through supply administration. He wrapped both hands around the mug. Linda's signature is on most of them. Some of them don't match the physical inventory. Megan said nothing. I signed off on 3 of those reports, Ethan said, as the supervising attending. I didn't... He stopped. I didn't look at them closely enough. I signed what Linda put in front of me. She looked at him. Did you know what was in them? No. He held her gaze when he said it, which counted for something. But I should have looked. He set down the mug. That's a different thing from not knowing. I should have looked. She nodded. Yes, you should have. He stood with that for a moment. He didn't try to soften it, which she appreciated. The conduct review is still Friday, he said. I know. I'm going to recommend to the panel that the documentation of my statements about your Delvey intervention be used as a case example in the hospital's nursing assessment training. He paused. What I said, how I said it, what it cost you in terms of that shift, if they'll include it. She looked at him for a moment. It wasn't a comfortable thing he was offering. It was the kind of self-exposure that took something to put on the table. She didn't sentimentalize it, but she registered it for what it was. That's a good idea, she said. He nodded once. He picked up his mug and left. She sat in the break room alone for 3 minutes, which was all she had. She drank the rest of her water. She thought about Kellner in the surgical recovery unit, unconscious but stable, 26 years old and with an outcome that still wasn't certain but was possible in a way it hadn't been at 4 p.m. She thought about Marcus Delvey in his regular room, breathing on his own, probably asleep. She thought about Dorinda Vance, fractured arm, furious and alive. She thought about the parking lot at 1 p.m., the key in her hand, the sound of the helicopter, the decision her feet had made before she'd consciously authorized it. She hadn't come back inside because she'd wanted recognition. She hadn't come back because she'd wanted to prove something to anyone still watching from the ER windows.
She'd come back because a military helicopter had come in with a specific approach pattern, and she was the most qualified person in the parking lot to respond to it, and the idea of not responding to it was, it turned out, something she was not actually capable of. That was useful information about herself. She filed it. She went back to the floor. The formal commendation process from Naval Special Warfare moved quickly relative to most institutional processes, which meant it took 12 days instead of several months. She received written notification on a Thursday morning, read it at the nursing station, put it in her locker, and went back to her patients. Priya found out about it somehow. She didn't ask how. And told the break room, which meant by noon, the entire floor knew. People responded in a range of ways. A few of the nurses said something direct. The monitor tech who'd been in Bay 1 during the Kellner intervention found her in the hallway and said, "I didn't know what you were doing in there, but I knew it was working and I've been thinking about it for 2 weeks," which she thought was one of the more honest things anyone had said to her at this hospital. Ethan Ward said nothing. He nodded at her across the nursing station when he came in for his shift, which from him was something. The physician conduct review took place on Friday as scheduled. She was asked to provide a written account of the events of the day, which she did, factual, complete, in sequence, without editorial. The review panel included 2 physician representatives, 1 nursing representative, and an external member from the state medical board. She was not in the room for the deliberation, but the outcome came down 8 days later. A formal written reprimand in Ethan's file, mandatory completion of a communication and interdisciplinary respect training module within 30 days, and a requirement that any characterization of nursing staff conduct by attending physicians occurring in a public staff area be documented and subject to review. It was not a dramatic consequence. It was not a public dismantling. But it was real. It was in the permanent record, and it would be there every time his file was reviewed for the rest of his career. That was how institutional accountability worked when it worked, not as theater, but as record. The federal investigation into the hospital's supply procurement practices resulted in a formal inquiry that pulled Hale into 3 days of documentation review and produced a preliminary finding of financial irregularities totaling approximately $240,000 across an 18-month period. Linda Mercer was placed on administrative leave pending the inquiry's completion. 3 other staff members with supply administration access were also placed on leave. The investigation would take months, and its outcome was not something Megan would witness in its entirety, but she understood its shape, the slow, grinding accountability of institutions when the documentation finally outran the people who had been managing it. What she felt about Linda was not clean. That was the honest version of it. Linda had made her first 3 months at this hospital harder than they needed to be, had filed a report that could have cost her a career she'd built from scratch, and had apparently been operating within a system of financial misconduct that had nothing to do with Megan personally, but had created a floor culture that rewarded loyalty to hierarchy over accuracy of observation. That was worth being angry about. She was also aware that Linda had said, in a room with HR representatives present, that she had been wrong, had not qualified it, had not buried it under procedure, had said it and let it sit. People were complicated. That wasn't an excuse. It was just the truth of it, and she had seen enough of people on ships, in theater, in the compressed intensity of operational environments where there was no performance possible because the circumstances stripped performance away, to know that complicated was the standard condition. She'd met bad people in her life. Linda Mercer was not one of them. She was a person who had done wrong things within a system that had rewarded her for doing them, and who was now facing the weight of that. Megan decided that was enough of an understanding. She didn't need it to be more resolved than it was. Kellner woke up 4 days after surgery. She heard about it from Garrett, who called her from a number she now had saved. "He's asking about you," Garrett said. "Tell him I'm on shift." "I told him that. He said to tell you that he understands, but he wants to know if you drink coffee." She stopped in the corridor and looked at nothing for a moment. "Tell him I drink bad coffee out of habit and good coffee when I can find it." There was a pause on the line. "I'll tell him that," Garrett said. His voice had something in it that wasn't quite a smile but was adjacent to one. "He's going to be okay, Calloway." "I know," she said. "I need him to be okay. His outcome is on my record."
Garrett laughed, a short, real sound that surprised her. That's the most Calloway thing you've said all week. She went back to her shift. She visited Kellner on a Thursday afternoon, 9 days after surgery, when he'd been moved to a regular room and was sitting up and annoyed about the dietary restrictions, which she took as an excellent sign. He was younger looking awake than he'd seemed unconscious, which was generally true of people but was more pronounced in him. Without the emergency, he had the face of someone who still had a version of uncomplicated in him, underneath everything the service had put on top of it. He looked up when she came in, and the expression on his face was the particular expression of someone who was looking at the person who had made a specific decision on a specific afternoon and knew it. "Chief Calloway," he said. "Just Calloway," she said. "I'm a nurse." "You're a nurse now," he said. Not argumentative, just distinguishing. She sat in the chair beside his bed. "How's the head?" "Ferrant says I have some deficits to work through. Memory stuff, some processing lag." He said it directly, the way people did when they'd had a few days to absorb information and had decided the way forward was to say it out loud without making it larger than it was. "She says most of it should resolve, some of it might not." "She's honest," Megan said. "That's the right thing." "Yeah." He looked at his hands. "I've been told that what you did in that bay, the intervention before surgery, that's why I'm having a conversation instead of being a different kind of outcome." "You were also healthy going in," she said. "That mattered." "Sure." He looked up. "But don't do that thing where you make it smaller than it is." She held his gaze. "Okay." "Thank you," he said. Just those 2 words. No construction around them. "You're welcome," she said. Just those 2 words back. She stayed 20 more minutes. They talked about Havenport, which he'd never been to before, and was now going to have an extended opinion of whether he wanted one or not. They talked about physical therapy and the particular indignity of needing someone to hand you things you could normally carry without thinking. He asked about the hospital, and she told him the true version, the version with the full day in it, and he listened without interrupting. When she got up to leave, he said, "Garrett told me why you left the service." She stilled. "He said you didn't tell him. He said he inferred it." Kellner's voice was careful. "He said he thought you'd seen enough loss to need somewhere to put all the not losing for a while." She stood at the door with her hand on the frame. "He's right," she said. "More or less?" "Is it working?" Kellner asked. "Being here?" She thought about Marcus Delvey breathing. Dorinda Vance, furious and alive. Kellner having this conversation. She thought about Priya keeping pace in Bay 1 with a marker on her wrist and catching her own mistake and moving on. She thought about the parking lot and the helicopter and the choice her feet had made before her brain caught up. "Yeah," she said, "it's working." She left the room and walked the corridor back to the elevator, and the hospital moved around her the way it always did, occupied, imperfect, never quite enough resources and never quite enough time, and always another person through the doors who needed something that only this work could give them. She pressed the elevator button. She thought about the woman she'd been at 6:47 that Tuesday morning, checking the crash cart in Bay 4 alone before her shift started, restocking it without telling anyone, moving through the floor in a way that people read as forgettable. She hadn't been hiding. She'd just been waiting to be somewhere long enough that the somewhere felt like hers. It felt like hers now. The elevator came. She stepped in. There was a lesson inside this that she'd carried a long time without knowing how to say it, and it was this. The people who underestimate you are not giving you information about yourself. They are giving you information about the limits of what they've been willing to see. That's their failure of imagination, not a fact about your capability. The dangerous thing isn't being underestimated. The dangerous thing is when you start to agree with it. When the silence they impose starts to feel like the truth. When the smallness they assign you starts to feel like a description instead of a cage. She had never agreed with it. That was the thing she was most certain of looking back at the day. Not the procedures, not the interventions, not the outcomes. The thing she was most certain of was that she had never once believed what they told her she was. That was its own kind of training, maybe the most important kind. The elevator opened on her floor. She walked out. Priya was at the nursing station, mid-chart, and looked up when she came in. "Kellner good?"
He's annoyed about the food. I think he's going to be fine. Priya smiled. There's a new patient in Bay 4. Chest pain, possible cardiac. Tyler flagged it for you. On it, Megan said. She picked up the chart. She walked to Bay 4. She knocked on the door frame and looked at the patient. A man in his late 60s, nervous, his wife beside him holding his hand too tightly. And she said the same thing she said every time. My name's Calloway. I'm your nurse. Let's figure out what's going on. And she got to work.